Good morning, everybody. First, I'd like to introduce Dawn O'Hara, our newest member. She's from representing Central New York. Dawn, are you here today?
Morning, yes, I am, and I'm very happy to be here. Thank you so much.
We are happy to have you. And by the way, if you look at the slides before, we do have 2 vacancies, and we're looking for people to represent Taconic and Hudson Valley. So starting in New York City, is Deb Reed in today?
It's Deborah Greif, Brooklyn.
Mary Fasano, Long Island.
Okay. And Buffalo, we have Ann and Crystal, Ann Sheriff and Crystal Hassler.
That's correct.
Yes, correct.
I don't have my WebEx set up yet because they didn't let us into the room until about 2 minutes ago. I guess there was already a meeting that ran up to 11 o'clock, so it didn't give us any time in the space.
Starting, Crystal. Okay, and in Albany, we have Scott Brady. And we have Jan Fitzgerald. Here. Maria Suchi Kozak. Here. Chris Palega.
Here.
Tina Veal. Here. Mary McGuire.
Here.
And in virtual,
Yeah.
Aaliyah, have you gotten on? We'll continue to work on that, Aaliyah. And here in Central OPW people, we have Alexis Harrington.
Good morning, everybody. It's Alexis Harrington from OPWDD. We have a few other OPWDD staff members in the room with us today. We've got Chad Colarusso.
Good morning.
Morning, Nick Hobson, FSS Statewide Coordinator.
And then we have Colleen and Amy behind the screen and the WebEx today. And then we have some folks on.
Oh, gosh, I know.
Sorry, what was that? Aaliyah, did you have a question? Oh, okay. So we have Rachel Baker on, if you want to introduce yourself.
Good morning, everyone. Rachel Baker from OPWDD.
And Aviva.
Morning, everyone. Aviva Kindo from OPWDD.
And Anne Marie.
Good morning, everyone. Anne-Marie Peterson from OPWDD.
And Christine.
Good morning, Christine Carey from OPWDD.
And Ralph.
Good morning, Josh Olson, OPWDD.
And Kevin.
Good morning, I'm Kevin Valenches from OPWDD.
Thank you. That's all who we have on from OPWDD.
Next, we're going to just review the agenda and what's coming up today. I do want to remind our speakers and our panelists as you speak today, make sure that you move up to the microphone. And if you could, especially if you don't have a laptop open so that people can see who's speaking, make sure that you announce who you are so that those that are viewing or listening know who is speaking. We're going to have some updates from Aviva Kindu on behalf of the acting commissioner. And then we'll move into some program update and information. We'll be learning a little bit more about some follow-up that OPWDD has done since our June meeting regarding annual survey practices, contract reviews, and site visit protocols. They conducted a survey, so they'll share those results with us and provide an update on data sharing for program evaluations. We'll also have some FSS Family Reimbursement ADM updates. And we'll talk about that as we move forward. Advance the slide, please. We'll also hear a little bit from Fiscal. OPWD's Fiscal Department will talk to us about some RFP next steps, timelines, and regional priorities, as well as reimbursement fund guidelines. We'll get some updates from Counsel on local bylaws. We'll hear some priority area updates from subcommittees, including the bylaw subcommittee. Then we'll take a brief break. If you could advance the slide, please. And we'll continue on those updates talking about the reimbursement ADM. Our CDPAP recommendations will be moved to an offline conversation, and we'll be able to report more on that at our next public meeting in December. We'll hear some advocacy updates. We'll hear from our community engagement subcommittee, formerly known as the stakeholder engagement subcommittee, on their updates on regional council membership and the fantastic work they've been doing, as well as some proposed changes they'd like to see on the OPWDD website if possible. And then we'll open it up for public comment before we close, and we will have a brief offline meeting with the panelists. So without further ado, we will jump into our agenda. And I'm going to turn it over to Aviva.
Thank you, Gail. Good morning, everyone. As I previously stated, my name is Abiba Kindo. I'm the Deputy Commissioner for the Division of Service Access Program Implementation, Stakeholder Support at the office. Acting Commissioner Bayer sends her regards and has asked that I fill in to provide you with an update on the latest initiatives. The final managed care report from Guidehouse was released at the end of August and is now posted on our website. I know that many have been asking about the report and when it might be available. Just to recap, the final report does not recommend a full transition of the OPWD system of services and supports to managed care. The report specifically recommends that the OPWD HCBS waiver services should remain in the fee-for-service model, which is how OPWD currently delivers and pays for services. The final report offers several clear suggestions and considerations that we believe warrants further evaluation, including improved integration of care for the physical and behavioral health needs through specialized managed care organizations supported with value-based payment structures, the continued evaluation and improvement of the CCO model of care coordination as a means to leverage more effective service coordination and person-centered outcomes, continuing to build on the goals of the strategic plan to improve the quality of care and access to services by increasing the availability and access to meaningful day and employment activities, as well as making regulatory and policy changes to improve health equity and access and reduce administrative complexity. We're also seeking to increase the capacity to serve people with complex needs. The report also highlights areas of the current system of supports and healthcare services that are working well for people with developmental disabilities based on the feedback received. These specific areas include OPWDD's home and community-based services and supports, helping people meet their goals such as residential day, community habilitation, and family supports and services, positive care management experiences for people in need of services who can be supported individually, and the ability for people to receive services based on their choice through person-centered planning. As for the areas that are not working well for people with developmental disabilities, these include barriers to accessing care, including provider shortages and lack of specialty providers, complicated administrative processes and long delays. Access to quality care is more difficult for people with complex medical and behavioral needs, as well as those living in rural areas of the state. And there's a lack of consistency in receiving medical, behavioral, and dental care, or people simply being denied care. It's also outlined within the report that if the agency were to decide to further examine managed care for our system, the next step would be a feasibility study. With all of this in mind, I want to stress that no decisions on the recommendations of the Guidehouse final report will be made at this time. For folks that are not muted, just hearing some feedback on this end. I'm also excited to announce that the Office for People with Developmental Disabilities is creating a new advocacy services office, which will report directly to the acting commissioner. The office is being created in acknowledgement of the importance of the voices and experiences of those who receive services from OPWDD and their families, and will be led by a new advocacy services director. Recruitment for this position is underway. This new office will lead the peer specialist program, as well as oversee the ombudsman program and focus on other advocacy efforts. Just to remind folks, the peer specialist program, just to remind folks about the peer specialist program, recruitment for the program began early 2024, and we anticipate that we will have all staff on board by next month. The peer specialist program will advocate alongside and on behalf of people who receive services, strengthen the capacity of self-advocates and the self-advocacy community to represent their own interests, educate people about their rights, and ensure that decision makers consider the perspectives of people with lived experiences by participating in staff training, providing input on policies and procedures, working with OPWDD leadership. For those of you who are not already aware, OPWDD has selected Community Service Society of New York as the new ombudsman to develop a program to help people with developmental disabilities advocate for themselves and help resolve concerns related to accessing services provided by OPWDD, care coordination organizations, or other providers certified by OPWDD. As the new ombudsman, Community Service Society of New York will educate people about their rights, provide a process for timely and independent resolution of concerns related to the access or to the delivery of services within OPWDD's not-for-profit and state-operated systems. They will also refer people to legal representation when needed and provide data-driven feedback to OPWDD about how to improve our service system overall. We're working with the vendor now on program development with a goal of launching the program by the end of 2024. The initial focus will be on vendor training and hiring to support program implementation. As a reminder, we have some regulations that were issued and comments are due at the end of September 29th to be exact. For two new proposed regulations, these two new proposed regulations are the supported decision-making regulation and the pathways to employment regulation. Just to remind folks about updates, updates to the supported decision-making regulation would outline the supported decision-making processes. It sets criteria for both formal and informal supported decision-making agreements. It prescribes the authority of a formal supported decision-making agreement and third-party obligations to honor it. And it also defines the care coordination organization's role in supported decision-making processes and updates notice requirements in existing OPWDD regulations. With regards to the updates to pathways to employment, the regulation defines what pathways to employment services are. It expands the types of allowable services. It reorders the language to match other employment and vocational services to make the regulation clearer. It requires community-based vocational experiences for the person to assist in building a career path, and it sets the requirements for billing, training, and documentation. Switching gears a bit, I just want to speak with folks a little bit about our workforce initiatives, which is another area we remain focused on, addressing the workforce challenges. Our work has continued to support the direct support profession and has resulted in over 2,000 direct support professionals to date receiving advanced credentialing and bonuses through the National Alliance for Direct Support Professionals eBadge Academy, with more direct support professionals enrolling every day. Additionally, Governor Hochul has awarded SUNY's Direct Support Micro-Credentialing Program an additional $32 million to expand programming on 21 SUNY campuses and is expected to support 6,000 students by the year 2030. As well as our $9 million joint recruitment and marketing campaign with voluntary providers, More Than Work, which has driven over 24,000 job seekers to both the state and participating providers' websites since its launch in March of 2024. The campaign, which highlights the value of becoming a direct support professional, has been extended by an additional 2 years. So you all should continue to see the campaign featured in ads all across the state. With regards to employment, we just want to recognize that October is National Disabilities Employment Awareness Month, and we're looking forward to participating in Governor Hochul's 3rd Annual Disability Rights and Employment Awareness Month, or DREAM. The DREAM Symposium is scheduled for October 1st at the Empire State Plaza. The event is an opportunity to celebrate the value that disabled New Yorkers bring to the workforce through a variety of workshops and to assist in matching prospective qualified candidates with employers at a job fair. OPWD also plans to celebrate the month by highlighting people with developmental disabilities who have shared their employment success stories with us. An updated employability toolkit for businesses available on the OPWD website, as well as raising awareness for employers with a new video aimed at encouraging more businesses to employ people with developmental disabilities. In advance of the upcoming general election on November 5th, OPWDD has released an informational flyer about voting rights and the ways that direct support professionals and others can support people with disabilities to vote. 2 great resources for voting information are from the Self Advocacy Association of New York and Disability Rights New York. In the voting section on their website, you will find a Get Out the Vote guide, as well as their My Plan to Vote worksheet. In the voting section on the Disability Rights New York website, you will find additional resources, including 13 things people with disabilities need to know. And another important reminder is that the deadline to register to vote is October 26th. I'll now hand it back to Gail and Kathy to get the agenda started. Thank you.
And it's from.
Sorry, you were muted. You were muted.
Thank you, Abiba. Thank you, Abiba. Our next topic are program updates. And I'm going to turn it over to Nick Hobson.
Morning, this is Nick again. Colleen, can you just advance the deck to the next slide, thanks. So, since we last met in June, we've been working on several things internally, and we're going to provide you with some updates on those things. We conducted an internal survey. I think we released it back in June. Probably got the results. I think in July. I'm sure someone can correct me. And we reached out to all the regional field office staff to gain insights on a lot of FSS related work things like the family satisfaction surveys, contract review process, and site visit protocols. We took all this data and have reviewed it on our end, and we're taking that information to help develop some standardized practices around those things. Our goal with that first being, we want things done, consistently across the state and as we work with our local council partners. And we also want them to be involved as much as possible. I think you've heard me say before, but we depend on our local council members and the statewide committee members to influence how FSS funds should be used, how programs should run, things like that. So this is that continued effort to develop that collaboration between those members and our regional field office staff. Next slide, please. So I'm going to go through a few slides that show some results that came out of those surveys. This data was collected across the 13 OPWD districts. So OPWD has 5 regional offices broken into 13 districts. And the first part of that survey was around the annual surveys. Also what I refer to as the family satisfaction surveys, might be what you know them better as. And across the board, we saw that all the districts are conducting those annually. They're completed by individual programs versus the providers themselves. And the surveys were sent out by providers and not from the councils or the liaisons. So we're happy to see things are being done the way they should pretty consistently around the family satisfaction surveys. Next slide. And a little bit more on those. We're also seeing that across the board, surveys have been standardized. That's actually a process we undertook a couple of years ago where we actually worked with members on the statewide committee to develop one uniform survey. So that's been available for the last couple of years now, but we're happy to see it's being used across the state. And almost every district indicated that they're using the survey and the aggregated data in some manner. We only received that one. It's not at this point, so. So by and large, though, family satisfaction surveys are being done pretty consistently statewide. Next slide. The next part asks more about the site reviews and the site visits, and this is where this is a process where annually regional field office staff and also council members have worked together to review sites, whether that's in person or sometimes that's been done virtually. It's obviously been, with during the COVID period, obviously a lot of things were done virtually in order to continue doing them. So there's still seeing a hybrid on that, but all of our districts reported that site visits are being done annually. We are seeing, like I said, a mix of if that's being done in person, virtually, or a little bit of both. You can see there, it's definitely varies right now across the state, how it's being done those different ways. And almost all the districts shared that there's responsibility between the local council members and the FSS liaison or the FSS coordinators. So, like I said, we're seeing a lot of that collaboration, and I should step back for one moment to say all of these things that we surveyed our regional field offices on we knew were happening before now, but we just wanted to get a clearer picture of how exactly they're being done. So it's not, none of it's a surprise that it's being done. It's more of determining how exactly it's been done over the past few years. Next slide. And then the next piece on the survey that they filled out was on the contract reviews. And so, once again, a lot of times you might hear these referred to as annual reviews. Still got to work on making sure we're calling things consistent names so we're not confused. But, FSS programs we run through contracts, that are held by OPWD. So, as part of that contractual agreement, there's reviews that are done annually, and things like the contract deliverables and work plans and deliverables and things like that are reviewed at that point. So it does tie into some of the program review stuff, but it also gets into more of the nitty-gritty details around contract obligations. As you can see on this slide, all of our districts confirmed that they're conducting those reviews every year. And they're also all, once again, occurring as a joint effort between local council members and the providers, really the regional field office staff as well, since they're all part of this process. Next slide. And then we also asked in this slide what the involvement of the deputy directors were at each regional field office. And we're happy to see that all districts reported that their deputy directors participate in the council meetings, and almost all of them reported back to us that they're participating in our community of practice meetings. So that's our monthly meetings that I hold and have with all of the FSS staff at the regional field offices. So that's our way of being able to communicate a lot of the things that you hear, a lot of the things that are going on in the background in between these meetings, those are discussed and communicated at those monthly meetings. So we're happy to see the involvement from our deputy directors as well as our regional field office staff. Next slide. Next, I'm going to move into some data sharing updates.
And Nick, just pause for 1 second. I know that was a lot of information that we just went over of just assessing the current state and how things are currently being done. Are there any questions about that whatsoever?
Sure. Can you hear me? Did we survey the family support councils themselves? Or just OPWDD staff?
So far, this was just an internal survey from the regional field office perspective. So we wanted to start there, but if there is a desire to kind of do a two-prong approach and assess how this is kind of going from the provider perspective, we could certainly do that as well. We know that the regional field offices are obviously working closely with the providers every day. So that was why we wanted to start there, but open to your feedback.
Sure. I didn't mean the providers. I meant the family support council staff, the volunteers who would probably not agree that there's been full participation.
Yeah, that's a great point. So this perspective is only from the regional field offices. So what we wanted to do today was just preview this surveyed information so you could see what we collected, but there will be additional conversations among us, the statewide committee and OPWDD, to just map out what those next steps are going to be and what that consistent process is going to look like. Obviously, there are some areas that are non-negotiable because it is connected to contractual requirements that we have to fulfill as an oversight agency. But the whole point is for us to just preview this and then have a further conversation about getting us all on the same page for a consistent process. So thank you for raising that. I understand it now.
Crystal, also, you have a comment?
Did you unmute us? Hi, going way back, you guys mentioned about workforce initiative. I was wondering about the elimination of 14C. Has there been any initiative to allow individuals to work at a lower income rate due to their lower productivity because they're unable to work competitively with their neurotypical peers? And I know 14C allowed that for them to be able to earn some amount of income, even though they're not able to produce as much work as their neurotypical peers. Has there been any initiative to assist these individuals that are no longer receiving that service?
So Crystal, this is Alexis from OPWDD speaking in the room. I think that's a great question. I think we could be talking about that for quite some time. So I would like to just connect with you offline. We have a team that is dedicated to employment and meaningful community activities that is kind of following along very closely to what the federal government is contemplating around the elimination of 14C. So if you wouldn't mind just reaching out to me offline, I can put you in contact with that team who can just talk with you a bit more about those specific initiatives.
Okay, thank you. I just want to make sure everybody has the opportunity to have employment.
Understood. Thank you.
Thank you. Thanks, Ann.
Alexis, this is Abiba. I think it's just important to highlight that, and maybe this is something if folks are interested and can be previewed as well, right? I think that folks know that New York State will soon be an employment first state, right? And so there are a number of initiatives that OPWDD is working on in collaboration with other state agencies to be able to not only shore up, but to also enhance the continuum of supports for pre-employment as well as employment related programs for people with IDD. So just certainly wanted to highlight that. And as we move forward, not only with the Dream Symposium and Employment Disability Awareness Month, there'll be additional work and updates that we can share with folks as well.
Thank you. All right, back to you next. Sorry.
No, it's fine. I need you to let me know when we need to pause, so I appreciate it. So next up, changing topics a little bit. We have been working for quite some time to come up with a more, once again, consistent is going to be my word of the day, process around data sharing. And we, our overall goal is to have, when we talk about data share, we're talking about information that local council members need in order to do all of that work that we just talked about in those previous slides, those program review and site visits and all the other things that we ask for your input on. So we are still developing a more consistent template tool, whatever you'd like to call it, to do that. But in the interim, we are, and we've communicated this out to our regional field office staff already, that any regionally specific data, which would include things like utilizations, can be periodically updated and made available to local councils on a quarterly basis. So the FSS staff at the regional field offices are aware that that data, they've been collecting that data for forever, but they can start to share that with local councils in order to be better informed on, like I said, all that, those program related decisions and contract related issues and those things like that. So if there's any questions about that, we can obviously discuss that separately, but they have been made aware that that data sharing should begin, and hopefully has already started before I'm going to be telling you this. So the information that's going to be collected, like on a more consistent basis, like I said, we're working on a template that at some point, and it's looking like a next year thing at this point, would be made available to, you know, the FSS staff as well as the local council members. So everyone would know what information is being collected and what information is being shared. And like I said, how often it's sent out. Like I said, I think a quarterly basis is probably where we're headed with that. And like I said, that will help to inform all of that work that we're working on, making consistent practices with as well. So, can slide, please?
Yeah.
Yes.
If any of the local council members have issues accessing that data, or there's any further confusion, can they reach out to you?
Okay. Yes, of course. I always point to me, Amy, or the FSS shared email box, which is Amy and myself. So any of those email addresses you can find me.
And it's Alexis. Just putting in a little 2 cents here, little context. So we had all of the greatest intentions to try to get something more useful to all of you that is consistent, without realizing that we didn't exactly have an interim plan or approach to do so. And so it was like we kind of fell off a cliff there, where we stopped what we were sharing previously in an effort to work towards that consistent template. And we realized that that was putting a pause on the sharing of data for these contract utilization reviews and everything that you guys need access to. So I just wanted to apologize for that delay that happened and occurred as soon as we understood the impact of that. And without that clear communication, we fixed it. So I just want you all to know that you should be receiving the data that you were always receiving all along, but we're continuing alongside those efforts to try to streamline and consistently format all of that data, because we know it just looks a little bit different across the state. The data is pretty much the same, but sometimes even the format of it is looking a little bit different from region to region, or district to district, or local council to local council. So we are working on just improving that process for all of you.
So thank you again for clarifying, and I'm going to move into the final few things I have. So these are next sections around some of the family reimbursement ADM updates, and I'm going to go back in time. The last meeting that we held in June, we shared a lot of the updates we made to the FAQs document and to the allowable and non-allowable list. Those are available on the PWDD website, where you find all the other ADM related documents. We are developing a trainee for our stakeholders. We don't have a firm date on that yet. It looks like what we're going to do this time is do that as a pre-recorded training, and then we will notify everyone when that's available in various places, such as the website. And for those who have access to SLMS, it'll be something available there as well. So that once we have recorded it and it's where it needs to be posted, we'll send out a message to regional field office staff, as well as statewide committee, and all of our various ways. We also have our CCO team works closely with the care management entities to share that out as well, since they typically like to get that information as well. So there'll be various communication methods to get that out once it's available. And I think so. The last bullet on that, so the ADM process and policy issues captured through various surveys still remain under consideration. Like I said, we have a lot of different data gathering methods. We're taking all of those to consistently make these updates. So pointing back to the FAQs and the allowable, non-allowable list, that those changes come from, various places. We collect information from obviously our statewide committee and our local councils, from our regional field office staff, and from other groups within OPWDD, once again on site, like our CCO group. So we have various channels that help inform the changes we make to these different documents. Next slide. So there's a couple of other changes that have been in the works for a bit. We've heard from various places that instructions for the family reimbursement application would be helpful. That's something that we have developed. It's not yet completely final or available yet, but there will be an instruction sheet that goes along with the application. The application itself is going to remain unchanged, but there'll just be some more clear, honestly, for every single item on there, there'll be clear instructions of this is what we're looking for in that particular box. And so our goal, like with all of this, is to hopefully make it a little bit easier to fill out. We understand the applications. A lot of times it's done by care managers, but other times it's done by families, because obviously not everyone has a care manager, right? So it's important, to make this as easy as possible and to make it as clear as possible, so that whoever's completing it and submitting it to a provider is doing it as well as possible, so they can make things move just that much more quickly when we're getting people reimbursed for goods and services. Next slide. And another update that we made is to the family reimbursement tracker, or I should say we are in the works of making changes to. We have both the tracker and the instructions for the tracker are in the final stages of a review. So we took a hard look at that, because I think, and any of you who have looked at the tracker or used it know there's a lot of columns. So we went through and were able to eliminate several of those columns, which are listed here. I'm not going to go through every single one of them, but we realized they were either redundant or just didn't were captured in other columns, or we just weren't really getting. It wasn't information that was really needed to be able to do a thorough review. So as you can see, there was, looks like several columns we were able to eliminate. So I'm sure for you, especially for our providers and our regional field office staff who deal with these, they'll be happy to have a few X boxes to fill out. Next slide, please. And that's where I'm concluding for today. That last piece, if there are any questions on those last few updates and around, that's the time for that. All right.
Does not appear to be any questions or comments on them. But on behalf of providers, I'm sure it'll be very much appreciated to decrease their workload. So thank you for taking a look.
Not true. Question. I have a question.
Go ahead, Deb.
Okay. Nick, thank you very much for all that information. I have been working very hard with the rest of the committee members who are with me on the ADM reimbursement. And one thing we would like to, if you could explain to us why certain items are now on the non-allowable list. I don't want explanation right now. I would like that in writing, because it's very frustrating. A lot of the agencies said to me, why can't we do this? Why can't we? One thing that has bothered a lot of the agencies, and I know parents, is a lot of families love to go to a zoo because they consider the zoo an outdoors type museum, as same with aquariums. So I'd like to know what is the reasoning, say, example for that? And for some of the other things, I know there's too much on the list to discuss, and I know there's time. There has to be time, but I would like to meet with you, Lexus B, because this really needs to be discussed, because I get questions by not just families, but by the professionals and the care managers. So I'd appreciate if you can, we can meet at another time to discuss this. Thank you.
Yep, that's certainly something we can do, I think, and I always encourage people to do this. If there's specific things on the list that need further clarification, it's really best to email that to us, so that way we can really give you a full response and not just be trying to, like I said, come up with something off the cuff. So I encourage you to send that our way, and that's something we can look more at. Thanks.
You're welcome, and I will, but not today.
Nick, would you be willing to attend an upcoming subcommittee meeting with the ADM group? Maybe talk a little bit through some of Deb's questions?
Yep, I can also do that. Just need to know when and where.
Thank you.
Yep.
Are there any other questions on that topic? Aaliyah, did you have a question? Aaliyah, you're muted. We still don't have audio on Aaliyah. We still can't hear you, Aaliyah. I'm sorry. While Aaliyah works with her audio, let's go over to Crystal.
She's unmuted now.
Crystal?
Hi, we're having a technical issue here. Anne can't see the slides on her laptop. And based on the last question that I had, we still have a thing popped up saying, unmute yourself, stay muted, unmute me. So we're not able to see the slides. Are you able to send us in Buffalo a copy of the slides at the end of the meeting? Because I know Anne has to have these for her notes, since she's the secretary. Plus, I think we should get the copies of the slides anyways after the end of the meeting for everyone who's a stakeholder, in my personal opinion.
We'll get those slides to you in the next few minutes, Crystal. We'll email those to you and Ann.
Yes, especially without us having the agenda, it makes it even more difficult for Anne to do her job.
And we've asked for support here and he hasn't come back.
Yeah.
Okay, we'll get the slide deck to you in the next few minutes.
Okay, thank you. I appreciate it.
We had sent out an agenda previously, and it is very, very similar to today, but we'll get the updated slide deck to you. Do we have audio on Aaliyah yet? We still can't hear Aaliyah. Oh, no.
She's unmuted.
Aaliyah, you might want to look into your, next to mute, there's a little arrow. If you click that, check what microphone you're using. That might be part of your issue. Hopefully we'll be able to hear from you shortly. Are there any other questions before we move on? Aaliyah, if you have a question, you're welcome to put it in the chat. We might be able to address it that way. Okay, we'll move on to the next segment of our agenda, which is fiscal update. Over to Kevin.
Hey Kevin, if you're talking, we can't hear you yet.
Well, with that, it's now noon, so good afternoon. Sorry about that. I was muted. You would think after 3 or 4 years, I would not remember to press the unmute button. So we just have a few things on the fiscal agenda that we wanted to talk about. If we can just advance to the next slide, please. There we go. So I think really, I'll talk for a few minutes here about the RFP timeline. I know that we talked the last meeting about getting more of a sense of timing to, begin to release the funds associated with the RFP we've been discussing for the last little bit. And what we wanted to let you know is that we've been working through the process internally here between the contracts team and Alexis and Aviva's folks, and we are finalizing right now the formal, the application, the RFP itself, and all relevant attachments, and that's work that's actively underway, and we expect to wrap it up within the next week on the short end of the spectrum. So that would be great. And just from your perspective, right? We wanted to give you a sense of the timeline and really when we're going to be looking for your assistance to help evaluate the responses that we're going to get back. And so we expect to release the RFP right now before the end of this calendar year, right? And there are going to be a lot of factors that can, accelerate or maybe delay this a little bit. But our goal right now, based on, workload and other activities, is to formally release the RFP. Let's just call it in December of 2024, right? So before the end of this calendar year. And that, there's a series of other steps that have to happen within the construct of a procurement once the RFP hits the streets. There's a lot of question and answer opportunities. There's, debriefings and things like that that have to happen. But that we would expect that we would engage with, with you all in terms of evaluating the responses to the RFP, say February, March, or, in that kind of time frame, mid to late Q1 of the next calendar year. So, the January to March period is Q1, when we would expect to engage with you all on, providing assistance in evaluating the technical aspect of the responses to the RFPs. So really think towards the later end of that period. So I would say, could start as soon as February, mid-February, or a little bit later, but that we were going to give, several weeks for that review to happen. So I just wanted to kind of highlight that for you all. We would expect at some point that if our timelines are adhered to, we could look to have contracts, finalized by, I would say the end of the second calendar quarter. But just note that we still have up to 90 days for the State Controller's Office to review and approve contracts. They are ultimately the final arbiter, and if a contract is not OSC approved, it's not a contract. So, we could be looking at a little bit longer, but I think that in terms of the relevance to you all and your participation in the process, we're looking at, say, February, March, commencement of activities to help evaluate those responses.
Kevin, this is Kathy. I have a couple of questions.
Sure.
When do you foresee training on how to work the electronic evaluations and familiarize us with the questions?
Yeah, no, I think that's something I need to get more of a definitive timeline on. I would just say that if we're looking at, say, mid to late February at the earliest to start evaluations, we'd have to have, you all trained on that process prior to then. So I would say sometime, between, I would say, January to mid-February would be the process and timeline for that.
And how do you foresee this? Will we all be together at the DDRO, or will we be doing this at home on our own?
You mean in terms of issuing the RFP or more generally in terms of evaluating the responses? Because I think each response will be done
Yeah.
right in
Training.
the,
Yeah.
oh, the
Kevin,
training.
Yeah, in the past, we've had the FSS reps come into the regional field office. So I think Kathy, we would be working, with Alexis and Anne Marie and folks, right, to sort of identify times that work for folks and make sure that folks are physically in a room to be able to do this. So that's something that we can provide some additional direction on. Sorry to interrupt, Kevin.
No, you're right. I mean, oh, sorry, go ahead.
I was just going to add to that, and that is really just to be a support to you, to all of you, like, so you have somebody there to answer questions. They are independent reviews, right? Everybody's kind of scoring independently, but we want to be able to make sure that we have responses if you, in addition to the training, that we can help you through the process. So that these are times where in-person does help, but it'll be done at the local level, so we can provide that to you. Sorry, that's all I wanted to say, Kevin.
I agree, Anne Marie. We have a lot of new people who have never done this before at all. And what I found in my experience, it was helpful to have others because questions do come up. It's not like someone's coercing you into scoring a certain way, but sometimes there's questions and somebody needs to be there to help the person through, the family member through. My other thing is, it might be the second quarter of the year, but our fiscal year down in Region 4, starts July 1st. And I know probably would be helpful if we could have it completed so we could start July 1st with our contracts. I don't know if that's going to make a difference if it's pushed back to September, but it's just a fact. We have another question here in the room at Albany.
Yeah, Kevin, this is Scott Brady. Will we get notification before the RFP goes out?
I don't know. I mean, we don't normally provide notification here, right? We would release the RFP is going to be issued in a public venue through the contract, the state contract reporter, state register. So what would you guys want?
Well, I was just thinking, we worked hard on the needs assessment and going through the process. So just a heads up, hey, it's going to go out, at a certain time. Not to interfere with the process, just to, all these folks have been involved at some point. It's be good to get a heads up.
Yeah, let me take that back and see. We can, about giving you the heads up. I mean, we would just have to ask discretion, right? That we wouldn't be able to pass that information along to any potential bidders. I mean, it's going to be an open competitive process, right? And any inside information is not, appropriate from that perspective. So yeah. Yep. Okay. Yeah, let me follow up and we can, follow up through Alexis and Nick and let you know.
Thank you.
Any other questions?
Awesome. Okay, thank you, Kevin. You're off the hook. I think I'm an honorary fiscal member. So I'll keep on going through. So next slide. So speaking of all the hard work that you guys have done in compiling the prioritized areas for this RFP, we did want to just communicate that to all of you, just to revisit and let you know these were the areas that you guys all identified. It also went through the regional field office and we have reviewed all of these areas. So these are the areas that are going to be in the RFP. We're not in a restricted period right now, so it's okay for us to have this conversation. So each of the local councils were able to prioritize areas. So this was all done through the needs assessment that I think, Chris, you kind of led technologically in pulling that information together. So if we just go through the next few slides. We're going to walk through the priority areas together. So for Region 1 priorities, Finger Lakes South, social and rec activities, respite and transportation. Finger Lakes Monroe, varied types of respite, service access, behavioral supports, innovative and high needs programming. Western New York North, respite, behavioral support, after school respite, recreational program. Western New York South, after school and rec programs, transportation, behavioral support. Few themes there. Then for Region 2, for Broome, we have respite, after school programs and camps have been prioritized as a need. Central New York, varied types of respite, crisis support and intervention services, and recreation and camp. And Sunbelt, weekend, social and recreational respite. And the next slide. We're frozen. Yeah. All right, well, lucky for all of you. Oh, there it is. Okay. I spoke too soon. So Region 3 in Capital District, they prioritized in-home behavioral services, recreation, site-based respite, and service access. In Hudson Valley, Westchester, it's respite, recreation, and camp, service access and information and referral programs. For Hudson Valley, Orange, Sullivan, and Rockland, recreation, behavior support and crisis intervention, and service access were prioritized. And for Taconic, recreation, behavior support, and crisis intervention have been prioritized. And moving over to Region 4. You can't see it yet, but you will soon. So for Staten Island, we had after school and weekend recreation and socialization, after day weekend socialization and recreation. For Brooklyn, we had housing advocacy, housing modifications, and crisis intervention. Bernard Feinstein in Queens, we had after school, weekend recreation, parent support groups, socialization group, and transportation. Continuing on, we have Metro and Manhattan, weekend recreation, socialization, community-based recreation, and parent support groups. And then under Metro Bronx, we have evaluations, applied behavioral analysis, after-school socialization and recreation with transportation. Region 5, the priorities on Long Island are service access, reimbursement, and horseback riding lessons. So just one thing I want to note is that within these areas where we have respite referenced, we cannot have site-based respite developed under FSS. So I just wanted to put that out there. I don't know, Abiba, if you want to add anything else to that before we take a quick pause and see if anybody has any questions.
Yeah, so site-based respite is reimbursed through the waiver, right? It's a certified, it's certified as an IRA. And so there's a separate sort of oversight mechanism for that, right? And so the various types of respite that was mentioned, right, could be developed under FSS, but not site-based, right, which is certified as their freestanding respites. So I just wanted to flag that nuance. I think there was one particular district that highlighted that, so we can certainly follow up with folks on that.
Thanks, Abiba. Yep, go ahead, Chris.
Yes, hi everyone, Chris Blaka. Just two questions on this. The first question I'm wondering on the site-based respite. I know in Monroe, we based a lot of our priorities on the idea that we would stand up site-based respite. This was because what we found, what many people found in Monroe, and I think in other areas as well, is that the Medicaid rates respite programs were just full and just not thought available, which is why we were hoping to expand site-based respite into FSS.
Chris, I'm sorry, I'm having a hard time hearing you. Can you just get closer to the mic, please?
Sure, sure. So a lot of the work that we did in Monroe and our priorities was based on respite, site-based respite, right? Not only for our standard population, but also respite site-based based on, you know, families with high needs and such. So we did that because we found, and I think a lot of people have found, that respite programs across the state, the waiver respite is full. And then there's also the question of people who are OPWDD qualified, but also not waiver enrolled, cannot access site-based respite. So we're wondering if there's any opportunity to kind of discuss that decision, I guess, further. The second question I have is, before the RFP is issued, will we, as local councils, have an opportunity to review the actual language of the asks in the RFP? Thank you.
So Chris, just on the first piece, right? We know that through existing contracts, folks have been able to develop respite services at a particular site that is not certified and have been able to address the needs of individuals sort of through that model. Separately, we are having conversations about freestanding respite capacity across the state, really looking specifically at emergency respite services and crisis respite services, right? Which, you know, there's a distinction between the two, right? One has really sort of a clinical infrastructure to deal with someone who may be dysregulated, and the other is sort of based on an emergency circumstance where someone might need to access that site because, you know, parents need to go out of town or there's a medical emergency. And again, those are certified, right? And so we wouldn't be using FSS dollars to create those, right? Because we would be working with, you know, specific providers and making sure that that the certification sort of meets muster, right, before we would move forward. But certainly folks can use the FSS state dollars, right, to support folks in non-certified sites. I think that, you know, Anne-Marie was highlighting that there are YMCAs and certain programs that folks have used, right, to be able to support folks. And so we can certainly look at that. But I think separate and apart, we are looking at the freestanding respite capacity statewide and looking to increase capacity there.
So as that increase happens, where do we sit in the interim for that, right? I mean,
Say that again, Chris. I'm sorry. Can you say that again?
so where do we look at in the interim then for respite if we're not standing up family support services, you know, programs for respite, site-based or at agency or wherever? We haven't.
I think on the priorities, it listed a variety of respite services, right? And so the variety, right, means a lot of things. Folks have talked about, you know, after school programs, right? There have been, you know, after school respite. So that's an option, right? There has also been recreational respite. So that's an option. But if we're talking about a certified freestanding respite, that is capacity that we are examining separately, right? And looking to see if we could issue sort of a separate RFP, if possible, for that capacity, but we wouldn't be using freestanding FSS dollars for that purpose. Folks have to be obviously eligible and enrolled in the waiver and be able to access the freestanding respite capacity. And that's a model that's under the certified structure, right? And we wouldn't be using FSS dollars to develop that.
So just for understanding, can you give me an example of what certified freestanding respite, just so that I'm clear about what that is?
Sure. So the site has a certification from our Division of Quality Improvement. QI provides actual operating certificate for that provider to be able to support folks in that structure, right? And so there's, you know, we have the ability to go in and do person-centered reviews if there are concerns or issues, right? and they're obligated to follow certain requirements because they have a formal operating certificate.
So that could be any number of provider agencies that we're all familiar with that.
Yes, absolutely. There are a number of providers across the state that have an operating certificate and operate freestanding respites, which most refer to as site-based. And it's also outlined in our respite ADM as our administrative memorandum as well.
Right, yeah, and I think a lot of our thinking in Region 1 Monroe is that we would be able to stand up those programs because we are at capacity or seemingly at capacity and beyond in those waiver respites. And again, the individuals without, waiver, those who are eligible with, but not waiver enrolled, how many other, families that might be also, are in need of respite. So I guess then that kind of highlights the second question is, will we be able to review the priorities that are actually being the language that's going in the RFP so that we can try to understand how we might work. I guess alternatives of programs that provide that type of experience for parents to be able to not have to be caretaking, but not be respite per se. I mean, and we start to, because a lot of our priority was really based on that freestanding respite. So we have an opportunity to kind of approach that from a language perspective and see if we can't.
Yeah, Chris, the goal isn't to change anything behind the scenes, right, without the statewide council knowing about it, right? Clearly, there was a lot of effort put into this. So I think that as we look at the priorities, if there are such concerns as I'm raising here, we would have a direct conversation, through our regional field offices with the council reps. We wouldn't be changing anything behind the scenes without folks being aware. So this is something that obviously, I think I saw also, I think it was Capital District, Region 1 and Capital District were the two that raised this. So we can certainly follow up with folks directly.
Okay, yeah, and I can start a conversation with my local council now to see if we might want to try to do something to will enhance the responses, I guess, is what I'm thinking is right now. Okay, thank you.
Sure. You're welcome.
All right, it's Alexis, back to my fiscal hat that I don't actually wear. So we wanted to just let you all know really quickly, you all meaning statewide committee and local council members will be getting the finalized version of the $3,000 reimbursement guidelines shortly. It just has to go through a few more layers of review before it is perfection. So what I wanted to just walk you through really quickly within that policy is just, yes, we can describe what that is. So there is going to be a background of this overall policy. It articulates who the Family Support Services Advisory Councils are made up of, noting that part of their routine operations, each local council will have access to $3,000 annually. These funds are intended to reimburse members for costs incurred while participating in the advisory council business for all reasonable expenses and operating costs incurred in the performance of their duties. So what we kind of articulate within this area is just some examples of what items are eligible. We also have some examples of things that are excluded, which will not be shocking to anybody. Items that are not directly associated with advisory council business or duties. Items or services which are intended for the personal, private use and benefit of the member or their family. Excessive costs or expenses beyond what would typically be afforded for a good or service. Luxury items and gifts and gratuities could not be purchased through this money, which is no surprise to anybody who is smiling at me in the room. So the other thing that we wanted to just highlight is that there could be some of this funding used towards care for a dependent family member, but when there is funding available through our own system, that should be pursued, right? If you're able to access respite and your loved one is approved for that, please use that and don't use the $3,000 that is limited to your local council within a year. And there will also be a direct reimbursement opportunity available for items that would cause a financial hardship. So we're talking, you know, if you're making copies of flyers or something like that for 200 people, there's no way that you would need to kind of front that cost. That would be a financial hardship for others. So there will just have some information in that policy about what that process looks like. So it's in the final stages of review. Don't quote me on what's in it because you'll get the final version yourself, but just wanted to cover kind of the high points of what you can expect within that policy when you get it. If there are any questions when you do receive that, we'll just compile those questions. We can either bring them to the next meeting or share some responses in writing. Obviously, you're going to want to tap into these funds as soon as you're able to. So I'll stop there and see if there are any questions.
Do you have an idea when we will be getting this?
So
Don't say soon.
not soon.
Not soon.
I will not say soon. I will say I am pretty darn positive that you will get it in no later than 2 weeks. I hope everyone from OPWD heard that. Sorry.
It's not here. Obviously, it's. Mary, I'm sorry, Mary, you have a question?
Did we give any input into what we thought we needed to use that $3,000 with?
Yes.
We did. It was that long that I don't remember. Okay.
We've been taking diligent notes on all the conversations we've had about this. We also touched base with Kathy and Gail to make sure, you know, some of these areas that were sticky, we wanted to make sure we clarified. So yes, your feedback's there. Any other questions about that? Okay. All right. Kicking it over to council then to talk about the bylaws. I think that is Josh.
Yep. Thanks. This is Josh Olson. I'm the Deputy General Counsel here. I know you're accustomed to dealing with Mary Beth, but she was able to retire this month, so congrats to her. So just a brief update on the local council bylaws. We have received new or revised, okay, my video is off, sorry. We've received new or revised bylaws from 10 of the local councils. We are waiting on drafts from 4. Those would include Western New York North, Bronx, Manhattan, and Staten Island. And then there are 3 that we just have not received anything from. And those 3 would be Hudson Valley, specifically the Orange, Sullivan, and Rockland County councils. Taconic, we've received nothing. And Queens, Feinson, we've received nothing. So if you happen to be on those councils or from those councils, bylaws would be very much appreciated. And of course, the statewide committee is encouraged to review the council bylaws just to confirm that they meet their expectations. And that is all.
We do just ask those councils that are still working on their bylaws, if you would, to please send them to Mary Fasano, and she will pass them on, just so we have a record of those being reviewed and stated.
This is Ann. May I speak here? Western North. I got bylaws that are sent back to be revised, and I sent them back. So they were in, and I don't know where they went, but I did return them soon after they were returned for Western North.
And I have my hand raised too in Buffalo. Ours too have been sent back. So I don't understand why Western New York is listed. Is there a specific council north or south that's not sent in? Or why isn't ours?
No,
This is
I have
Mary
it as
Fasano.
down
north.
this offline, maybe it just got lost in emails. Because I think Tina sent hers, I just recently sent mine, Staten Island. So, let's talk about this offline. It's only 4 councils. However,
Yeah.
Alexis has something to
That's
add.
fine. Yeah, we have Western South. It looks like we're waiting on Western North.
And I sent those in. I sent them back soon after they came through to me.
And I forwarded them, so I'm a little confused by this list. I totally understand the ones who sent nothing, but the other 4, I mean, I've back and forth with these several times, and we'll talk about it later. Okay.
Yes, no worries, Mary. Thank you for highlighting that. I know we're debriefing after this meeting, so we can definitely talk more about that. I did also just want to highlight that obviously these bylaws are required to be in place, right? It is articulated in the statewide council bylaws that the local councils need to have bylaws in place. If we do not have those in place, there could be impact on your ability to review the RFP. We have tied a lot of issuing this RFP into the bylaws, which articulate who constitutes a formal local council, who constitutes a formal council member. So it is critical that we get those bylaws in. We can set another deadline, but I will just say that if we do not have bylaws on hand, we will not be able to work with that local council to score and review RFPs.
So this is Scott for you. It's a process question. So I sent in bylaws, and then I was asked for revisions. Is there an approval process? So if they're in, are they going to be approved, or just that they're in, we're okay?
Yeah, so I don't think we're gonna give a formal approval. What we're really trying to do is just review it for consistency and that the core tenets are captured. So I think we can just talk a bit more about process in our debriefing, but I would say if we're asking for edits and you make them, consider yourself good. But we'll finalize that process offline. Thank you.
Can you hear me, please? No.
Yes, Leah?
Oh, okay. Thank God. Okay, so I forwarded the bylaws to Ms. Robin Mooney and CC it to Nick. I don't know why it is not sent to you. I had emailed also to Mary Fasano that the FSS coordinators, they have the bylaws, but then I will discuss with Mr. Robin Mooney and send it again. Also, I was just trying to, my comment was, since we have so many about the family reimbursement funds, I was just saying if the OPWDD can consider removing the reimbursement application, because now we have seen that they have trying to add the templates and other criteria to double check how the process is carried by the providers as well as how the families are applying. So that's my request, to consider to remove the reimbursement application. It's a hardship for the CCOs as well as to the family members if the care manager is not available. Thank you.
Hi, Aaliyah. We have a subcommittee led by Deborah Greif on reimbursement ADM, and I'm sure that your input would be very valued. I would definitely make sure that you share that with Deborah. And regarding the bylaws, it would be super helpful if you could send them to Mary Fasano. Make sure that she's included on that, because she's tracking and helping out keep order of those. And we also need to make sure that everybody's bylaws are aligned with the statewide bylaws. As Alexis mentioned, we're looking for certain tenants to be present. Are there any other questions?
I don't want to go into that detail because our bylaws has been set up for years back. I didn't create that bylaws. So I don't want to discuss it. It's too lengthy. You can discuss with our family coordinators. They always are there when we are updating the bylaws. Thank you.
You know,
We can
have
discuss
a
it further with
we have
Julia
a
offline.
bylaws committee, and we set, as a group, we set up a procedure, and it behooves each member to follow that procedure.
We can take the rest of the conversation offline, but yes, that would definitely be helpful because then we could be helpful in the process of ensuring everyone's bylaws are in line and submitted and approved. All right, are there any further questions? All right. All right, so we're going to, at this time, move it over to Mary. Mary, I believe on the bylaws, you had some updates and proposed changes.
Yes, there are, wait 1 second. There was a proposal which was mailed out to all of the members to revise the state bylaws. The biggest change was in the name of the group, because the name of the group from the mental health law is really the Committee on Family Support Services. So therefore, in our bylaws, we substituted Committee on Family Support Services, any place where it said statewide family support services. The other proposed amendment was on attendance, and that was outlined. And so that was what we're substituting, is that more than 2 consecutive absences, unless due to extraordinary circumstances, will be cause for removal from the Committee on Family Support Services by vote of the members of the committee. We, as I said, to adhere to the bylaws, we have sent a copy of these changes to all the members, and given 30 days notice, we will discuss and vote on them at our next Zoom meeting, which would be at the end of October. So there's no need for any discussion now. That discussion will take place at that time. That's the gist of what I have to say.
Okay, thank you very much, Mary.
I just wanted to add, if you look, we all have copies, if you look at the bullet, we're talking about attending meetings face-to-face in Albany or video conference as specified under the terms of our August 22 resolution. It's the open meeting laws, locations that have been secured, like the Buffalo site, the New York City site. So the attendance should be at one of those locations. And if you miss more than 2 consecutive absences, unless there is extraordinary circumstances, we have to talk, that does happen, then it would be cause. It doesn't necessarily mean it will happen, but it could be cause for removal from.
Yes, Kathy, that is in the
I just
proposal
wanted
that
to
was sent
mention
out to everybody.
2 absences.
Okay.
All right, we are currently ahead of schedule. We're scheduled to take a break from 1:10 to 1:25. The time is currently 12:40, so we're about a half an hour ahead. We're going to go ahead and move into our break right now, and we'll come back at 1 o'clock. Had an opportunity, hope you had an opportunity to enjoy lunch, grab something or take a break. We are back and ready for the second portion of our meeting today. Again, we are about 20 minutes ahead of schedule. So we're going to go ahead and hear about priority areas and updates from our subcommittees, starting with our reimbursement ADM updates. So for that, I will turn it over to the CFS New York office, Deborah Greif.
Hello, can you hear me?
Yes.
Can you hear me clearly?
Yes.
Okay. Good afternoon, everyone. First of all, I want to before we do, I want to thank my committee members, but I really want to especially thank you, Gail, because of your help. I mean, we realize that there's a lot of work more we have to do, but thank you for helping me at least setting up, which is not ready to be shown yet, the spreadsheet. There's no way on earth I'm good at spreadsheets. I'm good at getting data and giving it in, but not the spreadsheet. What we're working on is trying to understand how to get off of the now we understand certain things cannot be taken off. We understand that. But we want to get as much more stuff off the non-allowable onto the allowable. But we realize we need data and especially justification, because when you do fill out a reimbursement application, you do have to justify why you're buying this. What is the reason? What need does the child have? Well, so by doing this, we will be able to see that the reimbursement monies will actually go to the families' children, the families with their children who live at home with them, to be able to get the right help they need. That includes camp. We're happy museums were allowed. Now we would like also to work, but we will justify about the zoos or the aquariums and other things. We're not going into details. We will work together to update everything, and we know it'll take some time, but none of us are, as parents, we know what we have to do, and we're willing to work together. Now, am I supposed to say anything about the CDPAP or not?
No, actually, Deb, we're going to move that conversation offline. That's a portion of our agenda that we're not covering today.
Okay. The one thing I would like to ask is, and I did ask before, everyone who hears my voice, I would appreciate this. Please send me information of why when your agency, your care manager put in reimbursement and they were turned down. Why? So that we can try to figure out how we can streamline and also fix the process so that what you get in Buffalo, you can get it in Long Island too. And that to us is the most important. And we know it's going to be a while. It's going to be a constant progress. We're going to keep working just to keep getting everything updated. So when we're going to have our next meeting, which won't be decided today, we will discuss when the next meetings will be. And I would appreciate if Nick, if you could come. Alexis, you're more than welcome. So is Abiba. I'm fine with everybody, because you see, yes, I do allow Mr. Christopher Greif if my laptop's not working right, I always have to borrow his. But he don't say anything. But we just want to work, we want to work together. That's what we're there. We want to continue this really important service, which was really the first family support service they tried it. It was the first one they did. And honestly, you see how well it worked. So we want to make sure it's consistent across the New York State in all 19 counties. So after we will discuss when we have the meeting. I hope everyone understands I am of the Jewish faith. My New Year is coming and I can make the decision right after the New Year's. Thank you. Is there anything else I have to say, Gail?
No, I think you covered it, Deb. Thank you.
You're welcome. Thank you.
Okay, we'll move on our agenda if there's no additional comments on any of that. And I don't see any hands up. So we'll move over to our Advocacy Committee for any updates they may want to share.
Thank you, Mrs. Stemmer. I do not have any updates. So I apologize to you and the committee members. I didn't see an agenda ahead of time, so I really didn't know that I would be on the agenda for updates. So I apologize. And I thought, because I did miss the last meeting we had, that there was an agenda in place that didn't include advocacy. So I apologize, but I have no updates. What's that? I know, I saw the meeting minutes. Okay. So if anybody on my committee has updates they want to share, feel free. And I didn't come prepared. Sorry.
No worries at all. All right. Our next subcommittee to report out is our Community Engagement Subcommittee, formerly known as the Stakeholder Engagement Subcommittee. So I'll turn it over to Chris.
Hi, everyone. Chris Malega. Thank you very much, and thank you guys for the committee for some time to speak about our progress on building our network of local advisory councils. I remember being in this room back in, I think it was April of 2023, and talking to the panel and the community about a state of local advisory councils that was in a state of disrepair. We were, at that point, I'm remembering having 6 of our 19 councils that did not have sufficient members in order to be fully functional and be conducting business on their own. In the time that's passed since then, I'm really happy to report today that we are now at a point of 17 local councils, and they are fully reconstituted. The only barrier to full completion and having every council officially up and running is my inability to schedule a meeting to try to get everybody on it together at the same time. So we will be getting everyone together. We'll be doing a little housekeeping, electing officers, reviewing and passing some bylaws. And as soon as that occurs, I want to just share with you that phase 1, I think, of rebuilding the network of advisory councils will be complete. We will, for the first time in a long time, I'm understanding that it could be at least as much as 8 years that we've had both insight and oversight in every county in New York State by the Family Support Services Advisory Council. So I'm very pleased to report that out to you today. 2 things I want to share with you from my takeaways from this process and the year and a half or so that we've worked on trying to get together. The first thing I want to share with you is my gratitude. I'll start with the people and providers who took the needs analysis survey. Our recruitment question was attached to that. Thank you everyone who took the survey, who asked for more information, and even more importantly, thank you everyone who shared that survey link with their groups of colleagues and community members that they knew to help drive response rate. It was incredibly important, and we're very grateful to everyone who did that. I want to thank all the new members. I onboarded quite a few new members who had very little experience with FSS, and we're kind of wondering if they were able to be able to contribute and to be able to try to move the agenda forward. What I saw in all of these members, even short of having the knowledge that we will all develop over time and continue to develop, was something within them that said that they wanted to try to make a difference. And they stepped up, they showed courage and commitment. So all the new members who joined us, I want to thank you guys very much. I want to share some gratitude to the FSS committee for the support that we felt throughout this whole process, for kind of turning me loose and letting me run with it. And just grateful to have you guys, and especially everyone who took the leads that we generated from that survey and turn them into new members for their council, thank you very much. The gratitude just goes on. I mean, I just want to mention my local staff at my local regional field office. These guys are wonderful. They hang in with me in my local council when the conversation starts getting real. I know that you feel, I believe, my trust and respect for you as I, believe that you have the same for me. So having that as a base to work from is just incredibly important foundation in order to continue this work. So thanks to the local team and my RFO for all the support. I'm going to go on. I'm going to name a few names. I'm going to start with Crystal Vossler, who's a member of our committee, but in my mind, more of a partner in this whole process. She is dedicated, knowledgeable, hardworking, and always comes here and produces what we need. Her advice has been critical. So the results of this whole process have been greatly amplified by Crystal's work. I'm looking across at Gail Potto. Gail stepped up to help us with Central New York. She helped training and welcomed new members of CNY who are inexperienced into her local council meetings. She did work to create our first set of priorities, the preliminary work for that, and it made a lot of difference. So thank you very much, Gail. I'm going to look to my left. I have Scott Brady and Carolyn Huston, his chair locally, took the leads for Takata and worked those, brought new members in to their own council meetings and began training them up. And we're on the cusp of bringing that final local council online. Going outside of the advisory council, I'm gonna thank the leads at NIAD, the NIAD regional leads, the New York Alliance for Developmental Disability. This is an organization with some inspirational leadership and support of 12,000 members behind them. They have been embracing FSS since I arrived there. A number of our regional leads have actually stepped up and become members of their local advisory council, so I want to thank them. Moving from community to the OPWDD side, I'm going to start with Janet McKay in Region 2. I showed up in her inbox, a stranger with a plan and ready to move forward. Jeanette embraced it. We worked very closely on what we were seeing as the end result. She let me do the work. She was always there to give me support. And so I'm very grateful for the support from Janet McKay, and even more grateful to know and to feel her gratitude for getting a council set up there. There's John Cusinelli and Bijum Ibrahim, also in Region 3. As I turned my focus from Central New York down to Hudson Valley West, who had been many years without a council, I very soon ran into John, and John said, well, we're having a meeting in like 2 weeks. John already had a bunch of recruits that had found their way to him, had set it up, organized, and had meetings going. John also stepped up and did priorities for Taconic, so very grateful to you guys as well. So I wanted to share that gratitude. The other thing that I wanted to share in my takeaway from this experience is hope. I'm just grateful for the relationships that I've been able to form with the RFOs in Region 2 and Region 3. It encourages me to see how enthusiastic they are and how grateful they are to have councils and how ready they are to get to work, right? And I think the big piece of hope for me is looking at this process and seeing the collaborative effort of a diverse group of stakeholders across the spectrum. We were able to work together on a common goal, and we were able to achieve it. And so today, my message is really a message of hope. And I just want to share that what we did working together, we were able to make change. And so I'm very hopeful as we move forward into the next phase of the development of the advisory councils And I just want to ask the committee to share that out with me today. Thank you. So one thing Fiscal has brought up is we have some documentation that we think might be helpful for the growth of the council and for the education of the community. If we were able to begin posting some of the documentation that we're generating and be posting that up on the FSS website that OPW is hosting. A couple of things that come to mind. Number one would be our bylaws. They have our bylaws there, so people have an understanding of what we're doing. Another thing that we were thinking about asking to have posted was our, we have a digital recruitment brochure that kind of goes through the how, what, and why of membership on the advisory council. There's a link there to a new member application form that people can fill out and kind of streamlines the process. We're spending a lot of time distributing that, but we think if we could have it up on the OPWD website, since a lot of people are directed there, that would help move that effort forward. So we wanted to put that out there. If you don't have an answer now, perhaps we can get in touch with someone who would have the power, authority, or ability to make those changes, and we'd appreciate collaborating on some common documentation on the site. Thank you.
Thanks, Chris. If you could just send us the request in writing, then we can just loop in communications and have a conversation about the best place and all of that good stuff for that information to live. So thank you.
Any other questions or comments from panelists at this time?
So if nobody else has anything, it's Alexis. I just wanted to thank you, Chris. I think you had a thank you for a lot of folks, but did not thank yourself for the efforts that you have led in recruiting and advocating. And I know that, the advocacy was not really focused on recruitment, but it turned into recruitment. And you should be really proud of the efforts that you have undertaken to revive the local councils. I really appreciate the efforts that you've led, not only just how technologically savvy you are as well with the surveys, but I wanted to put that out there on the record publicly that I appreciate the efforts that you have put in reaching out to other local councils, reaching out across the state. You are thinking so much bigger than your own region. Obviously, you're advocating within your own region, but I think the fact that the entire state can feel your support is a pretty big thing. So I wanted to thank you personally for that.
Thank you both, and thank you, Chris. We are way ahead of schedule. At this point in time, we will be moving to our public comment section of our meeting. We are starting exactly 1 hour early. That's how good of time we make today. So thank you, everybody, for staying on topic. So we will now move to our public comment time.
Okay, so just as a reminder for public comment, we won't be answering any questions during this time. And we are limiting comments to 3 minutes. So I guess we'll start with public comment in the room. If anybody has a public comment here that would like to speak. No? Okay, so now we'll go to our remote location. So we'll start with Buffalo. Is anybody, anyone in the room in Buffalo want to make a public comment?
Yes, this is Crystal Bossler. I've had people approach me for my region about needing more support as far as working with the mental health world, getting rooms, like in the psychiatric units, but getting support when there's a mental health crisis prior to that, because the current process is to handcuff individuals. So if you can imagine someone who doesn't have the capability of understanding what's going on, but they're able to say that they're thinking about harming themselves. So a police comes by, handcuffs them, takes them by a police car, puts them into an emergency room. And then from the emergency room, if the parent can't get there in time, then they'll ask the individual, do you want to stay? And they say no, they're sent home, even though they still have the need and want to injure themselves. Or if the parent's able to get there in time, there's still that wait and what a lot of people call limbo, as far as trying to find an open bed within New York State for them to be in. But being handcuffed in a police car as if they did something wrong or illegal, and not understanding why all their rights was stripped from them and being treated like a criminal, there should be something better. We need to do better. We need to do more. I know that we have I might give the abbreviation around the CSIADD, or I don't know, along those lines, of crisis group that we have for OPWDD. They do not actually do anything for the individual in a crisis. And I feel like we should do better. We should treat our individuals better, especially since they don't understand what went wrong, why they were being punished, why they're being treated like criminal. We need to be able to provide support, crisis support for them when they're having an actual crisis, and help them bridge from being saying that they feel like injuring themselves to being into a bed that's safe, and for being in a facility that can handle them. Because I know a couple of individuals who were not able to even ask for water when they needed water while they're inside a facility for mental health. So if they can't ask for water, they can't ask for their basic needs, they're suffering. So there needs to be more of a collaboration between OPWDD and for the mental health world. Thank you.
Thank you for your comment.
May I make a comment too here in Buffalo?
We got Ann here in Buffalo.
Sure. Go ahead.
Okay. Okay. A couple of things. One is that I don't remember when OPWD issued it was the IDD ID. I don't remember what year it was now that it came out, but I had applied for my family members and had it was filled out through OPWD and then sent back to me. I had a situation recently, was at the state fair with two of my sons, and I asked my one son, who has more independent skills, to meet me at a certain spot when the fair closed. And it was on Labor Day, and the day before the state fair closed early, and they'd had some violence they had reported there. And I didn't realize my older son had heard about it, and I didn't tell him about it. But anyways, when we didn't show up at the meeting point, because my other son takes a long time to transition to Midway, my older son went looking for us. He thought something had happened to us. He did go to the state police, and I'd forgotten about the ID card that I'd given him years before, and he gave that ID card to the state police, and they called me, and they met me. Considering the state he was in, he was upset because he thought maybe there was more violence at the state fair, that he wouldn't have been able to articulate, and give them the correct information. And he might have been misunderstood by his behavior because he was upset. So I think that was a wonderful tool that you had developed. And I encourage other people to utilize it. It's something that's personal. They don't have to wear it around their neck or whatever, but they can keep it in their wallet and share. So I wanted to share that. The other thing was something recently, just an awareness that if families can have access to the CRO referral information, the letters and the applications, to ensure that the care managers are filling them out correctly And because that could have an impact on the, when and how a service might be delivered. So thank you.
Thank you very much for your comments. Is there anybody else in the room there that would like to make a public comment?
Just us.
Yeah, we're done with Buffalo. Thank you.
Okay, thank you. Next, then we will, go over to the New York City office. Anybody in New York City want to make a public comment?
Yes, hi. Normally, Christopher Greif would be here to make a public comment. Right now, he's stuck at the MTA about in reference with the budget. So I'll forgive him. But one thing I would like to make a comment. Years ago, when my son was much younger and in high school, I was my local precinct council president. And what I did was I worked with the school safety officers that were assigned from the precinct, as well as community affairs and the different detectives. And what I would have them do is start to work with OPWDD at that, so that they would understand because we had a lot of my family members had children who were runners. Also, when my son was in high school and I was the council president, there was a large special education population in his high school, the junior high across the street, and then around the corner, technically, was a specialized District 75 12-month program. What we did was we explained to the officers, and what we did was a lot of the parents who lived in my area met with the community affairs officers as well as the staff there in the precinct. They made sure that the parents we explained to them that there are times my child just runs. So by doing that, not only did they share the photos and explain the child may have trouble communicating, but they like to run, but they were more patient and understand. They also made sure to share this information with the EMS stations as well as the fire department. By doing this, and a lot of my parents still come to the meetings, it's made it, I didn't say perfect, but it made it a lot better. We also did this with the local New York City hospitals. And I think it's really important for across New York State that you need to constantly let all the hospital associations as well as the city hospitals know what OPWDD is. Because truthfully, one of the managed care claimed you guys were, and forgive me for saying this, OMRDD. And I had to show them that we haven't been OMRDD for years. So we need to constantly update and explain to all the other agencies, whether you did or not, keep doing it, because it will help our population and families too. Thank you.
Thank you for your comment. Is there anybody else in the New York City office that would like to make a comment?
No, we're good, thank you.
Thank you. Okay, so now we will move to some of the online folks. First up, we have Mayor. I'm going to send you a request now to unmute. And just a reminder for folks that we are limiting comment to 3 minutes per person, okay? Mayor, you should have gotten a request to unmute. Okay, you're unmuted. You can go ahead.
Okay, hi, my name is Mayor Buchinger, and I want to thank everyone here, especially let me start with Gail. I reached out to her over a year ago that we have to create a FSS council in our local counties. Our local region, Region 3, it's Rockland, Orange, and Sullivan. And also she transferred me also over to Chris, and Chris helped us actually forming this council. And early we talked, the council talked about the bylaws. We are in the middle of the forming the bylaws and voting on it. Hopefully by the next meeting we will vote on that and we will have it send it in. I have to also make a shout out to our acting commissioner, Bear. She is wonderful. She and her staff, Alexis is here on, and Abiba, especially also Chad. Um, and also this new nomination, that this new space that they created for advocates to reach out to them. It's very, very, very important, and I would like to see how it works out in the end. And this is a major, major uh, forward will bring forward the advocacy by setting up a designated person which will assess what the problem is. And I think with this position, we will figure out actually that, for example, the self-direction that the guidehouse evaluation will be. This will make it this job will kind of remove a lot of work from the guidehouse, because we will figure out that the whole concept of self-direction, for example, is a great concept. The issue is with a lot of barriers inside which we could change. And with this amazing staff in OPWDD, I'm sure that we will make a change soon. So thank you, Alexis, thank you, Abiba, and thank you, Chad. And looking forward to working with you.
Thank you very much for your comment. Okay, next on our list, we have Jacqueline. And I just sent you a request to unmute, Jacqueline. Okay, you're unmuted.
Hear me?
Yes.
Hi, good afternoon. I'm Jacqueline Tripodi. I'm a parent of a child with multiple disabilities who's 31 years old. He currently does live in a residence, but I'm also with an agency provider that has a contract to provide family support services. First, I want to say thank you. It'll be nice to not have a 32-column tracker to complete. As soon as you guys can get that out, that would be most grateful. This way we can effectively serve parents in a timely manner. That being said, I need to just document the fact that it takes quite some time for some trackers to be approved and processed. And, you know, that reflects poorly on our surveys, because we've submitted our applications and trackers. And it takes literally some weeks to get an answer to process the reimbursement. So it would be helpful to make sure that you guys have enough staff doing what they need to do. You guys are spread thin. The other piece I'd like to bring up is the CDPAP. I know you guys are going to have a conversation sidebar later, but I would like to very much emphasize that families who do have CDPAP services, I can respect them not getting reimbursed for respite care. However, there are other expenses that are incurred when you are a parent, and I can tell you from personal experience that happens. And this is something that truly, through family support, should be addressed and corrected, because not having the ability to apply for reimbursement for whether it be clothing, sensory items, or anything along those lines for individuals who do still have CDPAP, it's an injustice to them. So please, when you're having that conversation, keep that in mind. Again, I respect the fact that CDPAP, you're not going to do respite services to be reimbursed. That's fair. But if we're going to be fair and equitable, these families need that other support as well. That's what family support is about. And I also would like to say thank you about the instructions for the applications. I'm interested to see how that's going to be, so that families can get that clarity on what needs to be done. Thank you for the opportunity to speak. You have a very nice day.
Thank you very much, and thank you for your comment. Okay, it looks like I don't see any other hands raised. If anybody online was interested in making a public comment, you just have to click the hand icon at the bottom of the screen. And once you raise your hand, that'll indicate that you want to speak, and then I can send you a request to unmute. So we'll just give a few seconds for that.
Okay, I don't see any other hands, so I'm going to turn it over to Gail. Thank you very much. At this time, this is the close of our public meeting. We'll meet again in December. We do ask that the panelists all stay on the call so that we can have a debriefing meeting with OPWDD. Thank you, everybody, for joining us. We appreciate your participation and your support.